Guys, it's Miss Woodruff, and you may not recognize my special guest, but this is Mrs. B's beautiful muscle, and behind the beautiful muscle is some beautiful subcutaneous tissue, which leads us to our topic today. So today we are going to be talking about med administration, specifically subcutaneous med administration. And for this, keep in mind, again, your instructor may have different instructions. We're going to just teach you the basic principles. So in order to do a subcutaneous medication administration, first I have to know, okay, well, what kind of meds are given subcutaneous? So usually the top two medications given subcutaneous are going to be our anticoagulation and then insulin. So that you're going to give those to pretty much almost every patient in the hospital. So you're going to get very comfortable sub-Q injections. But in the meantime, let's talk about the basics. Like, what do I need? First, I need to get my supplies. So I need a sub-Q sized needle. And when I say sub-Q sized needle, is that when I'm trying to go into the subcutaneous tissue, I'm just trying to go in just a little bit. I'm not trying to go deep into the muscle. I'm just trying to get into the little bit of the fat. So usually you're going to see that these needles, they have a very short little needle that's just going a little bit into the tissue. So you can always look at the size of that needle to see if it's appropriate. So like, for example, this is an insulin syringe, and they usually have a special color. Then we also obviously need our medication. This says Tdap, but just ignore that. That's not actually what we're given. We're going to say this is insulin. And then, of course, you need a patient that needs it. And I have my patient here, and she has what do you call? Oh, yes, an alcohol swab, and of course, gloves and things like that as well. And I need my patient who needs to have some subcutaneous tissue. Now, regardless of what your patient may tell you, or even if you have a very severely malnourished patient, everyone has got a little bit of sub-Q tissue somewhere. So what do you call it? With most patients, we can find sub-Q tissue. The best places to look are the back of the arm. We can also, obviously, the belly is one of the best places. You can find some sub-Q tissue on some of the parts of the legs or the back, or not the back when I say is the bottom, like the love handles, things like that. But usually the most common, you're going to do belly. And usually I like around the bottom of the belly, under the belly button, kind of think of like a smile from the smile from your belly, kind of like right underneath, and then the back of the arm. It's always great to ask the patient where their preference is. Where was your last Lovenox shot? I can talk. Lovenox shot given, or where did you receive insulin last? Some patients prefer it in their arm, while others may prefer it in their belly. Generally, with anticoagulation, we usually always give that in the belly, but insulin can be given a lot of different places. Anything to add?
Mm-mm.
Okay, so once I have identified that I have the right patient, right medication, I've washed my hands, checked my orders, scanned everything, all those beautiful parts of med administration, I am going to grab my med and start to get ready to administer it. So let me create some room here so you can see this. That was not Miss B doing that noise. So here, first, I have my insulin syringe and also my insulin. Then, of course, I'm not going to go deep into sliding scale. Don't worry. If you're in my theory, you'll get to learn all about it. But I need to know how much I need to give. So let's say that I need to give 2 units. It's life-saving. A lot of people get it. So what I do, just like with everything else, you can see there's little numbers on this. And so this one, and by the way, a lot of students don't know this. You can move this white thing over to the side and twist it so that you can better see your numbers there. So I'm going to pull back just like I would with an IV injection, and I'm going to pull back for 2 units. And some nurse is going to need to check my insulin after. So I pull back 2 units of air, then I'm going to inject. If this is clean, I do not have to swab it off. And then, as I did with before, I'm going to pull back just those 2 units. All right, so I have that there. And then I am going to make sure that everything is clean and sterile. And usually in the hospital, something to know about insulin specifically is that some places are going to have insulin in the patient's room. Each individual patient has their own insulin vial. So if so, this might not be clean. You need to make sure to clean it. Other times it's going to be in your Pyxis or your medication machine. So you're either way, it's like a communal one. So you're going to need to take it out and clean it off before you inject it. So now I have my drawn up medication. I'm going to go into the patient's room, or if I'm already there, I'm obviously there. And then I'm going to identify some sub-Q tissue. So sub-Q tissue, if you'll come closer. And so I have some sub-Q tissue here, and I would just find a place with some sub-Q tissue. And there's a good spot here. And I say, hey, I need to give you an injection for your insulin. Here was your blood sugar. And then I would probably let them know the signs of hypoglycemia. If it was anticoagulant, I would let them know signs of bleeding, what to look for, and to call for help getting out of bed. So we want to prevent trauma. So I'm going to clean my area with a nice alcohol swab, and I'm not going to actually inject Miss B because she is my friend. But what do you call it? What you normally do is you kind of do like a pinch, and I'll tell you, it's not mandatory that you pinch, but I find that for myself it helps, and I prefer to do it. But it's not mandatory. So you squeeze a little bit of tissue, and then you take and you do. And I've seen a lot of you students like you've learned like the dart method, like, but remember it's not actually a dart, so be careful, like don't get crazy. So then you're going to inject it in and then just do real quick push. You don't need to hold or rub or massage. You definitely don't want to do that because that causes the medication to um, it causes the medication to be absorbed faster, and the whole point is in subcutaneous tissue, it's fat tissue, and it can slowly be absorbed. I'm not going to do it with this one because I don't want to waste it, but as soon as you're done injecting, you want to take this, like with this insulin syringe, you take with your thumb and you push this white thing up, and it's a safety for it. For the Lovenox, what you're going to do is there's a on the bottom of a syringe, because those ones are already pre-filled. You push up really hard on the bottom and a safety comes out. Anytime with the needle, you want to make sure that you are not just leaving it out or you're just walking around with it, because that's easily asking for a problem. So I'm going to get this to my sharps container as soon as possible. Anything to add, Miss B?
No, just make sure that you are verifying it with two nurses. Although I have been to hospitals where they don't use the verifying of the nurses, even on insulin. So you just have to follow the hospital's policy.
Yeah. So yes, always with your medications, just check to see if there are two nurses that need to check off on that, and that you're prepared to do that. And then, of course, the only other thing we didn't mention is because we were doing this injection, always make sure that the skin is intact. Don't do it in an area where the skin's not intact, and be looking for, like, for example, with like Lovenox or heparin, the patient may have a lot of bruising. I try to avoid and put it in an area where there's not a lot of bruising. Sometimes they can end up with like a bruise across their abdomen then, but we want to try to prevent any trauma or damage to the skin or tissue as a result of that injection. So yeah. All
We got
right.
it.
All right. Well, that's the end. I'll talk to you guys later. Bye.